but you're going to talk with us, and then we are live. So this is Senate Health and Welfare. We're back, and we are having an auditing overview presentation, if we could, from the auditor's office. And we have Doug Hopper, who is our Vermont State Auditor, here with us. And just in context, and I'm sure you're aware, I did try to share a little bit with you. We've been looking at a potential committee bill that includes possible auditing of our hospitals and trying to get at the flow of money, in particular with respect to our in-state and out-of-state hospital situation that we have with UVM. We also have other out-of-state hospitals. So just what role auditing can play in informing us, and how you see this issue. I guess that it's open for your sharing with us as much as you can. That'd be great.
Well, thank you and good morning. And my colleague here is our Chief Auditor, Tanya Morehouse, who can give you any and all that you need about the details of different types of auditing. Let me start by saying we already have detailed financial audits from, well, UVMMC and others, and some aggregate data about the members of the network. So that information is available, as I think you know, and that's where I think the board itself and now us and you have reason to believe that there is money moving back and forth across the network. So the hospitals are already audited. That doesn't need to, I don't think anything needs to be done there, although you could ask us to do a performance audit. That's different. But the real key is, if you want to get to the bottom of this, you're going to need the cooperation of the network itself. Tanya looked over the available information, and there's some pretty plain high-level stuff that's evident to interested parties and certainly to, professional auditors. But if you want to dig in a little bit and find out more about, well, we see that resources have shifted from hospitals to the network and then sometimes into New York State and back. If you want the details, you're going to need records and documents from the network. And unless I'm mistaken, the network is not covered by the authority granted by you to the Green Mountain Care Board. So even if the board, I think the board would like to answer this question, I don't think they're ready to do it in-house. They might want some help, and we can assist, either helping them prepare an RFP or be a part of a team. You can't go anywhere until you address the question of access to records from the network itself. So I don't know whether that's been part of your conversation to date, but it's absolutely.
No, yes, it is. I mean, that ultimately is the point. How can the board gain access to the information it needs for regulatory decision making? And so hearing your thoughts on that and recommendations on that are very helpful.
Now, I would imagine the network, won't be happy to learn that you're interested in folding them, into the board's purview. But it looks like the network is calling the shots for all of the hospitals within the network. And I guess that's the whole point of having the network at the top of the pyramid. And that's their business. They can do that if they like. But to the extent that it has a significant impact on hospital budgets and choices and decisions about future investments and whether Vermont money is going into New York, all that stuff is important to you, no doubt, and to the board, but you've got to have the records. So, I think your first step, the predicate issue, is amending the statute.
And the amendment would include what?
Well, I mean, if you want the board to have the authority to approve the health network's budget, that's one question. In the short term, the question is, do you want the board to have access to the records necessary to ask and answer some of the questions you have and others have? They're related, but not exactly. You can do the latter without doing the former. It's not for me to say, whether the board wants or needs to have authority to approve the budget of the network. It is kind of an interesting arrangement. The network itself presumably was created, at least in part, to achieve economies of scale and have some efficiencies by providing services to a group of hospitals. Therefore, that function, some of that function used to be part of all of the member hospitals. So how you cannot call the network part of a hospital is beyond me. I think they are definitely, providing services within the network that support the delivery of medical care. So I don't think it's a stretch at all to
No,
suggest that they can make.
I'll ask another question and then I want to turn to the data, access to data, and then the transparency of the network relationship. But in your experience with other organizations where you might see relationships like this, do you have access to oversight or involvement in kind of the organizational network?
As a rule, during my tenure, we have not addressed these questions really. We did kind of get around the margins for the PBM work we did for DHR or for the state a number of years ago, because that was a very convoluted arrangement, but nothing like this. As you know, Supreme Court has limited our reach to just the state of Vermont. Unless an agency or department authorizes a contractor or a vendor to provide records under the terms of the contract with them to us. So to answer your question, that's not our bailiwick, is doing corporate analysis of that type.
Right.
Having said that, Tanya comes from a financial corporate background. Before she came to Vermont, now many years ago, she was with Price Waterhouse and knows, most, if not all, the questions to ask. So we could be of some help to you. That's entirely up to you. So that's all I can say about that.
No, yes. So this is exactly what I'm looking for is we don't know what we don't know, and we don't know the questions to ask. So, perhaps Tanya, you can respond a little bit to what you're hearing. Would that
Yeah.
There you go. Be appropriate. Okay, go ahead. Thank you.
Sure. Tanya Morehouse. I'm the Chief Auditor with the State Auditor's Office. Nice to speak with you this morning. I think, we can't do this work in a vacuum on our own, kind of like thinking these issues through. The best way for us, I think, to be able to provide you with some advice is to work with the Green Mountain Care Board, because they'll be the ones that have the answers about what they currently do have the right to access in terms of records and what kind of pushback they've received from the network, if any, with regard to questions that they have asked or records that they've asked for. So I don't think that the state auditor's office on its own can necessarily, provide you advice about what the legislation should look like, but we could definitely work with the Green Mountain Care Board because I think, as Doug mentioned, we have expertise in terms of what types of questions to ask. What is the governance structure? Why was the network set up the way it is? What are the obligations among all the hospitals? Can money be moved around? Does the network have the authority to do that? Can the hospitals push back on that? What underlies the function and the corporate governance of the network? Do the Vermont hospitals have to step in and help pay the debt of the New York hospitals if the New York hospitals don't have sufficient resources to pay their debts? Or, can the network just decide to move cash on their own, right? And the Vermont hospitals can't push back on that. And those are the types of questions I think that we would look to work with the Green Mountain Care Board to note, can they even ask those questions? Can they get the records that would allow them to answer those questions.
So we would have to, the board would have to have the authority to get the records, and then, the interesting question here is how public do they become? Are they redacted when they're, given to others? Because there are a lot of questions embedded in what you're saying. And, yeah, I understood. Very helpful. Okay. So, so one of the things, are there other things? I mean, it is the transparency issue that is so key to us right now, because we know that many of our hospitals are in the red, and we know that the trajectory is not looking good for overall financial stability. And we also know that our largest academic hospital has the highest costs in the state and across the country, as in a comparative analysis. So this is why we're here. So we continue to need to push through this one. Are there other things that obviously having legislation that supports the increased transparency is important. Moving to my second idea or question is, yesterday we heard testimony from an auditor, healthcare from Massachusetts, by way of Florida, and who suggested that all the data is there. And she did a comparison of what would happen with UVM with and without the New York hospitals. And the question was, well, will the patients come to Vermont regardless of having a network affiliation? And then when we looked at, she presented the data, it looked like there were efficiencies and benefits to the state of Vermont without the network, without the New York hospitals. I don't know if you have looked at that data and can share with us your thoughts on that. I mean, her final comment was, you don't really need an audit. The data is all there.
You need someone that can interpret it.
You need somebody who can interpret it, like a Tanya Morehouse, or, so can you speak to that a little bit?
Well, I can offer one quick thought. The information provided, no doubt, by the network to Nancy, and we did see her slides, by the way. Thank you.
Yeah, good.
The assertion was that $271 million worth of value came from New York over to UVMMC, and that may or may not be accurate. But the question I would pose is, what did that relationship look like before there was a network? Your point earlier about it might happen anyway. We don't know the answer to that. And if most of it would have occurred without a network, then, where's the added value? Sorry, Tanya, go ahead.
So I watched Dr. King's presentation last night. I thought it was very insightful, and she made some really good points. And in particular, the slide that you referenced, Senator, about what does the network look like with and without the New York hospitals, and she spoke to the downgrading, I think, of the network's debt rating, which leads to increased costs of debt, because when your rating goes down, your interest costs go up. You have to pay a higher interest rate in order to get the debt. So with those New York hospitals included, the rating was dropped for the network as a whole. I don't know the answer to if those New York hospitals hadn't been, part of the network, would the rating not have dropped? I think Dr. King was somewhat implying that it wouldn't have. So there's a cost right there, right, that is being shared across the entire network. She made a good point that there's a lot of data out there, and it's really having the expertise to analyze the data and know what questions to ask. And again, I think I would reiterate that we we would best come up with those answers if we were working with the Green Mountain Care Board, because I think they have, well, I know they have way more expertise than I do in hospital oversight and hospital financial results. But knowing what questions to ask is key, and you don't necessarily need an audit to get the answers to those questions, but you have to have the authority to compel the entity that you're asking the questions of, that they give you an answer. And then it's a separate question of, do you trust their answer or not? You could do some work to validate the information that they're providing in response, and that could be an audit, I suppose. But I think first, really the key is, what is the question or questions, or what are the risks, that are identified and that need to be addressed.
Thank you. I mean, that's exactly the question. We need to know what we don't know, and we need to know what questions to ask. And your office is obviously the one that can help support that. Is there a necessity in having an external auditor and a different auditor contracted out into group to do this, or is it something that you can do from your office? With the board.
Hospitals have to have an external.
Well, all hospitals have. I'm not talking about that. I'm talking about something separate within the board purview. Yeah.
Just pass the cost on.
So I'm asking. Yeah, would it be your opinion that the auditor's office, the Vermont State Auditor's Office, has the capacity to work with the board to accomplish some of the goals that we're talking about?
I think that's fair. Yes.
Okay. All right. I mean, the concern obviously is, we all know the problem and we talk about the problem consistently. We're trying to get to a solution for some of this, for a lot of different things in the framework that we put out on the table. This is one piece of it. It's not immediate, it's not an emergency piece, but it is a piece that might get us to financial sustainability across the board sooner or later. Yeah, you got it. So anything else you want to add here? Because again, we don't know the questions here, so you have to help us with this.
Well, we're happy to do that. And if you like, we can contact the board chair and initiate a preliminary conversation that might lead to something we can come back and share with you.
I think that would be extremely helpful, and we will, of course, have the board in for testimony on a lot of this framework that we have in front of us, if not all of it, but your expertise and working with the board to determine what, if anything, we should have in the bill. The suggestion yesterday was we don't really need something because the data is there, but you're pointing out that there are other questions to be asked, and I'm particularly interested in, your comments, Tanya, your comments on governance and other areas that might have an influence in our state, and what value does it bring to the state to have this relationship. So that would be terrific. Doug, I would really appreciate it. Auditor Hoffer, I would really appreciate it. You're doing that. And then we'll see what comes of it.
It would be my pleasure. We will get to work and maybe get back to you next week as soon as we can.
Oh, that would be great. And I do have one other comment to make before you go. It's unrelated. But we took testimony yesterday from the Vermont Program of Quality Health, VPQHC, and they did indicate that there are blueprint outcomes that demonstrate success from their perspective. So just sharing that with you, you could look, if you might want to look at their testimony, but
I can assure you the audit team spent a great deal of time asking them for data about statewide results and came up empty. That doesn't mean they're not doing any good, but they couldn't answer the high level questions about that.
Yeah, and I also had an opportunity to talk with one of the early workers for the blueprint, Craig Jones, and he indicated to me that the data that was collected in previous years was not currently being either collected or evaluated in the same way. So there's work to be done.
Agreed. Thank you.
Yeah, so thank you. Thanks for your work. Appreciate it.
All right, we'll get back to you.